Nurses, I have some important updates regarding new hospital policies. First, we're implementing stricter hand hygiene guidelines. All staff, including doctors and visitors, must use alcohol-based hand rub upon entering and exiting patient rooms. This is to minimize the spread of infections.
I understand the importance, MIHIRA, but what about the impact on patient flow?
It might cause slight delays, but patient safety is our priority. We're also introducing mandatory influenza vaccinations for all staff. This is to protect both patients and healthcare workers.
Will there be exemptions for those with allergies?
We'll assess each case individually, but the vaccination is strongly encouraged. We're also revising our visitor policies. Only 2 visitors per patient will be allowed at a time, and visiting hours will be restricted.
I'm concerned about the emotional impact on patients, especially those with critical conditions.
We understand the challenges. We're providing additional support to patients and families during this time. These changes are necessary to maintain a safe environment for everyone.
Mihira, now that your stitches have been removed, it's a good time to go over the best ways to care for the area so it can heal beautifully. It's completely normal to feel a bit tender, but with a little care, you'll be on the right path. For the next few days, it's really important to keep the wound clean and dry. Gently washing the area with mild soap and water once a day, and then carefully patting it dry with a clean cloth is all you need to do. To protect the healing skin from any bumps or rubbing, you can keep it covered with a clean dressing or bandage for the next couple of days. This will also help to prevent any potential infection. As your skin continues to heal, it's wise to avoid any activities that are too strenuous, as this could put a strain on the area and cause it to reopen. Think of it this way. The skin is still delicate and needs a little time to regain its strength. You can also apply a thin layer of an antiseptic cream or ointment if you feel it's necessary. This can provide an extra layer of protection and help with the healing process. Remember, if you notice any signs of infection like increased redness, swelling, or pain, please don't hesitate to reach out to us. We are here to support you and ensure everything heals as smoothly as possible.